Welcome in, everybody. My name is Dr. James Cellini. I am a board-certified veterinary neurologist and neurosurgeon. On today's episode, I want to take this opportunity to go through what I believe to be my strangest case of 2021. I thought about this for a couple weeks into January 2022 here, and I came up with one case in particular that really stuck out in my mind. So I thought I'd use this opportunity to take you through this case from start to finish. We're going to show you the initial symptoms, the diagnostics, including this dog's MRI, and we're going to talk about some of the treatments that we did, and we're going to show you videos of this dog from before, right after, and then long after treatment, and show you how he's doing. This information was provided by the owner, and she gave me permission to do this, and I greatly appreciate that. Thank you very much. You know who you are. Before I get through the case, please, if you don't mind hitting the like and subscribe button, that would be great. It helps the algorithm, as they say, helps the channel. All right, let's get started going over Finn. To Finn. Finn is a very sweet old man dog, as we like to say. He is a 12-year-old shepherd who came in to see me because he had been having a very long, very chronic and drawn out, but slowly getting worse, mainly pelvic limb weakness. So I'll show you the video right here. This was provided by the owner, but this is what Finn had progressed to over the course of about 6 months. Finn had, by this point, required basically constant weight support by use of this harness, as you see here. And he eventually came in to see me through the emergency service and was triaged and evaluated because the owner was just to the point to where she was just distraught and wanted to find some answers. Okay, so the first thing you want to do with any dog who's showing neurologic signs is perform a neurologic exam. So that's what I did. But what we do with a neurologic exam is a little bit different from like a routine physical exam. We're trying to take a pet through a battery of tests that in many ways is similar to like a field sobriety test that you hopefully don't get, but it's kind of like a field sobriety test where we're trying to figure out what they can and can't do and take them through a battery of tests where we're testing things like their spatial awareness, their balance, little individual nerve functions, all sorts of different things. And by doing this, we're trying to accomplish what we call a localization. That's the most important thing in all of neurology because it's the first step and it's the basis for all of your diagnostic workup and your list of differentials or possibilities that could be happening. So when I performed a neurologic exam on Finn, what I discovered was that he had a problem in more than one spot in his nervous system. So in looking at him, he very clearly had pelvic limb weakness. You could see like in the video, this is how he was walking when he came in, and he's not able to really recognize where his feet are in space. We call that proprioception. And he was also very weak and not able to fully replace his paw and kind of was knuckling, as you see, kind of with his paw upside down here in the video. That set of symptoms typically would point to a problem in the spinal cord. We call it the T3 to L3 area of the spinal cord. I'll kind of diagram that right here. Now, the interesting thing about Finn's exam is that the clinical signs and his neurologic deficits didn't totally stop there. I noticed a myriad of what we call cranial nerve deficits. Cranial nerves are little nerves that pop out of your brainstem, more or less just your brainstem, and they innervate little muscles and glands all through your head and your eyes and whatnot. And they have very specific functions that you can individually test for in dogs. I was seeing evidence of a cranial nerve 5 trigeminal, cranial nerve 8 vestibular, as well as a T3L3 spinal cord problem. So we've got nerves up here in the brainstem and the brain, near the brain, as well as the spinal cord. So that's a very difficult localization to kind of rationalize. And whenever you see groups of neurons that are clearly affected, like way high in the head and lower down in the spine, you have to call this a multifocal localization because it not just explained, all these different deficits aren't just explained by one singular lesion. We have to have multiple problems in different areas. And our differentials extend from that localization. Now, when we're dealing with multifocal localizations, the differential list narrows a little bit. You can't have disc herniations in the brain. That's just not possible. There's no discs there, in case you didn't know. So it really boils down to things like cancer that are spreading to different areas of the nervous system, or things like meningitis or neuritis, where either Finn's immune system was acting up or Finn had an infection that was involving multiple areas of his nervous system. So once I had a localization on Finn of a multifocal problem, I presented this information to the owner and offered up to do an MRI of Finn's brain and spine, basically the entire central nervous system. And going in with this knowledge, the owner was a little bit hesitant at first, and very understandable to kind of be hesitant to spend a lot of money doing anesthesia, performing an MRI, and potentially a spinal tap on Finn. And how long this had been going on, it had been kind of assumed or at least feared that Finn was going to have a problem that we couldn't fix, and we were going to do a bunch of testing for no real reason. Older pets, it kind of becomes like how much do we want to put them through sort of a thing. But what I tried to reassure the owner was that an MRI, while we do have to anesthetize Finn, an MRI doesn't require any sort of invasiveness to it. It's just taking pictures of his body. So I think that helped a little bit, and it's what I try to tell most owners too. So we took Finn to MRI a few days after initial presentation, once the owner could kind of wrap her head around things. And let's go over Finn's MRI because the findings were very unique. Okay, so first, before we go any further, let me show you guys a normal MRI. This is from the University of Minnesota's Dog MRI Atlas. And this is a very good teaching tool and a very good reference point. I use this all the time. First, look over here. This is the reference image, if you will. So this is called a side view or a sagittal view. So the dog has their nose over here and the back of their head over here. So picture the dog facing that way, okay? Dog is facing that way. And they have a red line here, and that red line represents the level at which this image is at, okay? This is called an axial or a transverse. This represents basically pulling like a slice of bread out of a loaf and looking at it, okay? You've got your loaf sitting over here off to the side, and then you pull out a slice of bread and you look at it in cross-section, okay? So the brain represents what I just circled, but more specifically, the brain stem represents this area down in here. And in the normal dog, you have a pretty uniform kind of middling gray appearance of the brain stem. Okay, it's a little chunk of brain tissue that looks pretty homogeneous in its appearance, or it's all the same look. So what I want you to keep your eye on as I show you Finn's MRI is this area right here and right here in particular, okay? This is about where the trigeminal nerves would originate in a dog. And so notice how there's nothing here. It's all just uniform gray in the brainstem. But when we go to Finn's MRI, definitely keep your eyes right there. Okay, so now look at Finn. So we have the side view. We've got, again, this is the front or the nose. This is the back of the head. And the dog is facing this way. They're looking that way, okay? And then here is a cross-section. And then you can see my reference line right here. The MRI kind of generates a reference line, okay? So now, can you see the difference? I'll zoom in for you to help make it even easier. See if you can kind of spot the lesion while I do this. What Finn has got going on is two very large swellings right at the base of where his trigeminal nerve would be kind of starting from. Okay, can you see that? So this nerve and this nerve, both trigeminal nerves, left, and this is left, and this is right. Both nerves are very swollen. This is like severely swollen, and they're obviously not working normally either, okay? And the other thing that they're doing is the brainstem is having this like concave appearance. So they're actually causing compression. They're kind of smushing the brainstem. And that compression, I believe, is contributing pretty significantly to Finn's weakness, why he's so uncoordinated and weak when he walks, because the pathways trying to get through here are getting smushed, okay? So this fits very, very well with our list of differentials going in. Remember, Finn had a multifocal localization, meaning more than one spot in his nervous system was affected. And this represents most likely either inflammation, infection, or cancerous invasion of these two nerves, okay? And those are the exact differentials that we thought going in. So in order to clear up something like this, we perform a spinal tap, and I'll show you the results of the spinal tap right now. Right after the MRI, we performed a spinal tap on Finn. A spinal tap in dogs is a very low risk, very minimally invasive sort of a procedure. We essentially just shave a spot behind their head and sterile prep it, and then we insert a very small needle and collect some of the spinal fluid that surrounds the brain. Finn's spinal tap confirmed that there was a little bit of inflammation present in the sample. I'll put the result right here. But as you can see, we looked at two things, the cell count and the protein. I'll be very quick about this. The protein was, I'd say, kind of mild to moderately high, and Finn's cell count was kind of at the high end of the normal range. But basically it means there's just non-specific change. Something's irritating the nervous system, causing a little bit of reactivity, but we can't know for sure. This MRI finding and the CSF finding are a little bit frustrating, and this is just a very common scenario that we find ourselves in as neurologists, and I'm sure many veterinarians do with all sorts of different tests. They don't spit out a post-it note that says, oh yeah, here's the answer. You have to interpret these diagnostic studies and these images. With this information, I basically presented to the owner you know what, let's just treat the treatable. If this is something like an aggressive form of cancer, like say lymphoma, I don't know if we're going to be able to stop it once it's gotten into the nervous system. If this is something like meningitis, where Finn's immune system is causing the meningitis, then we might be able to treat that using a combination of steroids and other drugs, like say chemotherapy, to actually suppress the immune system. Yeah, we use chemotherapy to do that. So my plan for Finn was to start a combination of both steroid treatment to treat for just flat out inflammation in general, and in particular forms of inflammation that might be generated by his own immune system, as well as start a chemotherapy drug that's called Cytosar. Cytosar is a very commonly used drug in veterinary neurology, and the reason we use it, even though it's a chemotherapy drug, it has very good activity against meningitis because it's just good at suppressing the immune system and keeping the immune system from kind of attacking the brain. Now, admittedly, I was not sure if this was going to be the answer for Finn. I've never seen something quite like this on an MRI before. I went with my intuition. I kind of fell back to the level of my training, as they say. And wouldn't you know it, Finn started to make a pretty significant turnaround right after starting the prednisone and the Cytosar. The owner provided me with this video, which was taken a few days after starting both of those medications, and you can see there's a dramatic improvement in Finn's function. He's able to walk without a harness, his balance is much better, he's able to do things that are basically very close to his usual day-to-day activities. So over the course of the next few months, what we did was we basically just very slowly tapered down Finn's steroid dose. We started at a high dose to suppress that inflammation, and in about 3 to 4 week increments, we kind of worked the dose down. And by the end of 2021, Finn had been off the prednisone, off of all medications. The owner provided me with this video of Finn taken just a few weeks ago. So as you can see in the videos and the photos provided by the owner, Finn is very happy. He is living his best life right now at the age of about 12 to 13 or so. The owner is very happy to have her dog back. And also, not that this is as important, but I'm very happy. And to have the opportunity to improve this animal's quality of life by improving their mobility, it's really why you get into this job in the first place. And these are the types of cases you really have to hang your hat on and remind yourself why you do this job. So what is the take-home message from this case? For me, it was make sure that you stick to your training and the actual diagnostic algorithm. In this case, you know, I'm being presented with a 12-year-old dog who's had a very chronic and slowly progressive type of problem. And it's very easy to just kind of get into a thought process of, well, it's kind of just end-of-life stuff, and let's just keep him comfortable and let the disease run its course. Sometimes, and by no means am I saying this is all the time or even the majority of the time, but sometimes you can actually find a problem you can treat and reverse a lot of the clinical signs with treatment. Can't overemphasize that. It speaks to the fact that as a doctor, what you have to do is just stick to the facts and stick to the process of saying, okay, let's start with an exam, let's figure out where the problem is, let's figure out what the problem is, and if we can treat it or not. Go through that algorithm and try not to get caught up in the emotion of, well, let's just talk about end-of-life care because we don't have a diagnosis and things just look bad. It's very easy to think that way, but for me, I know, and I'm only speaking to me personally, it's a good reminder to take a step back and go through your training and go through the process and try to get, you know, as many answers as you can to try to give these animals a chance. All right, guys, hope you enjoyed that. If you liked what you saw today and you want to see more cases like this, please smash that like and subscribe button. Maybe leave a comment and let me know. I enjoyed doing this. I enjoyed reconnecting with Finn's owner and seeing how he was doing and getting all these updates and these videos from her. So again, thank you very much for watching this, guys. Have a great day, and I'll see you next time.